Varicose veins pain relief. If varicose veins home treatments are not working or causing a person severe discomfort, medical treatment is also available to help tackle varicose veins. A doctor may prescribe the following. Endothermal ablation. This is a procedure where heat is used to seal the affected veins. Ambulatory phlebectomy. This is where a doctor will puncture the skin and remove the varicose veins through small slits. Scarring is usually minimal afterward. Sclerotherapy. This procedure uses a particular foam to close the veins and shrink them. Ligation and stripping. In this procedure, the varicose veins are surgically removed. Laser surgeries. Here, intense bursts of light are directed onto the vein, making it gradually fade and disappear. Endoscopic vein surgery. During this surgery, a tiny video camera is inserted into the leg to help the surgeon see better. Removal of the veins then takes place via a series of small incisions. Outlook: varicose veins can cause discomfort and make a person feel self-conscious. Treating varicose veins at home is possible, and diet and lifestyle changes may improve the symptoms. People with severe varicose veins may wish to seek medical treatments to help reduce their appearance and improve symptoms. Talking through the options with a doctor will help an individual make the best and most informed decision about the right treatment for them. Advertisement. Last medically reviewed on January 31, 2020. Dermatology, vascular, seniors, aging, complementary medicine, alternative medicine. 12 sources collapsed. Medically reviewed by Deborah Rose Wilson, PhD, MSN, RN, IBCLC, RNBC, CHT, written by Bethany Cadman on January 31, 2020. Latest news: personalized brain stimulation lifts a patient's depression. Breast cancer, androgen therapy shows promise in preliminary study. What do we really know about antioxidants? Many psychiatry patients prefer online therapy. Paralyzed mice walk again after cytokine treatment. What causes boils on the inner thigh? Causes symptoms: when to see a doctor. Treatments prevention. Outlook: we include products we think are useful for our readers. If you buy through links on this page, we may earn a small commission. Here's our process. A boil or furuncle is a skin infection caused by the bacteria Staphylococcus aureus. It tends to thrive in warm, moist areas of skin, most commonly the nostrils, armpits, the crease between the buttocks, and the inner thighs. Boils can also spread under the skin and cluster. If this happens, the clusters form deeper abscesses called carbuncles, which may scar the skin. The size and color of a boil can vary, depending on how severe it is, or the amount of skin involved. However, most boils tend to have a similar appearance. Fast facts about boils. Fast facts about boils on the inner thigh. Normally, boils are not a cause for concern and do not require medical attention. It is usually not safe to drain boils at home. There are many ways to prevent boils from forming on the inner thigh. Causes and risk factors. A boil is a rounded, swollen bump that may be filled with light-colored pus. Boils occur when the bacteria Staphylococcus aureus invades the walls of a damaged or exposed hair follicle and colonizes it, causing infection. Some 10 to 20% of the population are carriers of Staphylococcus aureus. Being a carrier means that the bacteria normally lives on the surface of a person's skin. Carriers, and people with boils, can spread the bacteria through skin-to-skin contact. The bacteria can also spread through contact with contaminated objects, such as towels and sheets. In most people, infections only occur when the skin's natural barrier is broken or compromised by factors such as injury or friction. Anyone of any age can develop boils. They commonly appear in areas of the body prone to chafing, particularly the inner thighs. Certain factors are known to increase the likelihood of developing the condition. Common risk factors for boils include contact with someone infected with Staphylococcus aureus, nicks or cuts in the skin, living or working in a crowded area, obesity, immune conditions, being over the age of 65, diabetes, poor hygiene, animal scratches or bites, smoking, anemia, iron deficiencies, poor nutrition or diet, lack of exercise, prior use of antibiotics, especially multiple or improper usage in the past 6 months, other skin infections or conditions, such as psoriasis and eczema, long-term use of steroids or corticosteroids, intravenous drug use, extreme or chronic stress-specific factors may contribute to a high risk of developing boils on the inner thigh. These include Wearing loose or ill-fitting clothing while exercising, playing sports, or doing exercises that cause chafing of the inner thighs, such as running, long-distance walking, hiking, or biking. Wearing dirty clothing, particularly when exercising or engaging in activities that involve inner thigh friction or sweating. Walking or running in warm, humid climates. Shaving, waxing, and other means of hair removal that break the surface of the skin. Medical News Today resource: Virus spread and climate change. A West Nile virus case study. COVID-19 has made the entire world painfully aware of the terrible power that viruses can wield. Learn how climate change impacts the spread of other viruses, such as West Nile virus, in our feature article. Symptoms. While symptoms may vary in severity, most boils, a round, red, swollen bumps that grow gradually, are tender and sensitive, sometimes even to air. Eventually discharge a whitish-colored pus made up of dead tissue and blood cells. Last for around 10 days. Boils may appear alone or as a group. Boils that form a group or cluster are collectively called a carbuncle. Boils can appear anywhere on the body, including the inner thigh. When to see a doctor? See a doctor if a boil has more than one head or point, as shown above. Some boils require medical attention. Consult a doctor about boils that appear on the face or upper neck. Do not rupture within about 10 days of forming. Will not fully drain. Do not fully heal within 1 to 3 weeks of rupturing. Are very painful and do not respond to over-the-counter anti-inflammatory or pain medications. Become more painful and swollen after rupturing. Seem to be spreading to new tissues. Feel soft and spongy. Leak pus from more than one location. Are larger than 5 mm. Include more than one head or point. Are clustered or blistering. Have drainage or fluid that is not white or clear. Are surrounded by a patch of skin that is painful, abnormal in color, or otherwise looks unhealthy. A person should also see a doctor if a boil appears at the same time as any of the following symptoms: nausea, vomiting, loss of appetite, or unexplained weight loss, fever, chills, or other flu-like symptoms. Unexplained or abnormal bruising. Some individuals have a higher risk of complications from boils and are more likely to require medical attention.